Hey guys, and welcome back to Mondays with me, Dr. Crystal. By far the most common question I get asked on Instagram, YouTube, TikTok is, how do I become a sports medicine doctor? I want to do what you do. How do I do it? Where do I start? What should I be doing right now? Well, today I'm here with the answers. Let's go. So a long time ago, it was definitely over a year at this point, I made a video about my entire medical journey, where I started and how I got to where I am today. I will link that video down in the description if you have interest in that. But this video specifically is how to become a primary care sports medicine doctor, because that is what you guys want to know, apparently. For the purposes of this video, I'm going to start in med school, because obviously you have to become a doctor first if you want to become a primary care sports medicine doctor. A lot of people don't know, but once you graduate med school, you are officially a doctor, whether that be an MD or a DO. You've heard enough about that in the media lately. We are equal. It's the same. You can become a sports medicine doctor being either an MD or a DO. So this is step number one. Graduate med school and pick a specialty. I know, I'm making it sound a lot easier than it is. You have to apply, you have to go through the match and actually match into a specialty. You have to choose the program has to choose you. But that's not the point. We're talking about how to get there. Not all specialties have the ability to apply to a sports medicine fellowship, so you have to pick one that does. So there are 6 specialties you can choose from: family medicine, PM&R, pediatrics, internal medicine, med peds, or emergency medicine. All of those have the ability to apply to a sports medicine fellowship. I feel like a lot of people are thinking, like, how is this the first step? Don't you have to do anything before this, like during med school, if you want to do sports medicine? And the answer is no, not really. Me, for example, I didn't even know primary care sports medicine was a thing until the end of my 3rd year of med school. I was doing my family medicine rotation and I met a doctor who did primary care sports medicine. I thought it was awesome. I was like, yes, this is what I want to do. After that, I decided family medicine was the best way for me to go, so that's what I did. Like I said, you don't have to. Other people know going into med school that that's what they want to do, and if you know that, the best way to get involved is to find a mentor who does sports medicine. They might help you get involved in some research or some event coverage, but it's definitely not a necessity. If you don't know until later, that's completely fine. In residency, this is where the sports-specific stuff comes in. As soon as you know you want to go into sports medicine, you should start trying to get involved in residency. Going into residency, I knew already that I wanted to do sports medicine, so I picked one that I knew would have a lot of opportunities. Other places, you have to work harder to seek them out. But for me, it was pretty easy because I went somewhere that had those things set up. What should you be doing? I think the easiest and most fun thing to get involved with is sports coverage. So all through residency, I covered my own high school team. I was their team doctor. They would come to me if they needed anything. I also helped with one of the minor league baseball teams in town. We did rodeo coverage. We did a ton of stuff, but anything you can get your hands on. Usually the easiest thing is high school football. Other opportunities you can seek out are things like research, if there are people doing any sort of sports medicine research. Again, if you didn't have one in med school, or if you moved places, good time to find a mentor, somebody who does something similar to what you think you want to do. If you're interested in sports medicine, you should be doing extra rotations in sports medicine. So usually early in residency, you don't really have the opportunity, but as you get more elective time, picking rotations where you can get some experience and network with some people if you know you want to go into sports medicine. The last thing I have on my list to do during residency is to go to conferences. So our biggest conference is AMSSM. It's in a different city every year. It's super, super fun. It's good because you can go, you can sign up to present a case, which you can put then on your CV when you're applying, and you meet tons of people. And that goes so far when you're trying to apply for fellowship. If you've met people along the way, seen them multiple times, and they know you, they are going to be more likely to choose you for their fellowship if they like you. Coverage, research, rotations, conferences. Show your interest. Sports medicine fellowships are becoming a lot more competitive as time goes on, and so you have to show them that you're a competitive applicant. All right, step 3, apply and get into fellowship. So again, easier said than done. You have to go on all these interviews and smile and try to impress people, but it's really fun. Especially sports medicine interviews, you get to see the athletic facilities, tour the locker rooms. I think it's awesome. As of now, a vast majority of fellowships are 1 year. Some of them are 2, but most of them are just a year long. The most important thing is to choose a fellowship that will prepare you for what you want to do in the future. So if you're not really sure what you want to do, then you need to pick a fellowship that's going to train you for basically anything, for any job that might be available. If you potentially want to work with Division I sports, you should probably find a fellowship that has that, because you are much more likely to get a job in something if you have some experience in it. Most fellowships do a good job of training pretty broadly, but some of them have special little things that they do that other fellowships don't do. In fellowship, you learn how to be a team doctor, how to do better sideline coverage. You learn about musculoskeletal injuries, acute injuries, chronic overuse injuries, everything in between, arthritis, all that good stuff. You learn how to do injections, other procedures, and my favorite thing is you get to learn how to use the ultrasound. So yeah, sports medicine fellowship was great. Got to do some research, got to do some really cool coverage. For those of you who don't know, I did my fellowship at UNC and I got to cover UNC basketball, which was amazing. I got to do a lot of other really cool things that I will probably never get to do again. By far one of the coolest years of my life. And yeah, I mean, I don't want to do it again, but I would do it again. I was probably just as busy fellowship year as I was intern year of residency, but it was so much more fun because I was doing exactly what I wanted to do. All right, we're at the last step. Number 4, find a job. Finding a job is going to depend on a lot of things. And I think a lot of it is being at the right place at the right time. Because if there's not a need for a sports medicine doctor, they are not going to be hiring. Maybe 2 years from now, somebody's going to be retiring, but you need a job now. I recommend to be open-minded when you're looking for a job. Your first job does not have to be your forever job. I got lucky in that my first job is pretty much my dream job, but that doesn't always happen, and usually that does not happen. It's a lot easier to find a job if you're not tied down to a specific location, because then you can look a little more broadly, and that also gives you the option to be a little pickier with what kind of job that you want to do. So in the field of sports medicine, there is a lot of different ways you can practice it and incorporate it into your practice. Some people will just return to their primary specialty. So for someone like me, you could go practice in a family medicine clinic. You could see your normal family medicine patients and then know that when somebody comes in with a sports med complaint, you have extra knowledge on that. And a lot of times people in a practice will funnel those kinds of patients to you because they know that you have extra training in that. A lot of people end up in a split practice where they're doing partially their primary specialty and partially sports medicine, but they're kind of separated, whether that's 50-50, 75-25, but it'll be split up where they're doing both. Other people, like my wife Heather, do 100% primary care sports medicine. And so she just started her job recently. She only does sports medicine, so that's seeing musculoskeletal complaints, sometimes concussions as well, because that fits into the sports medicine realm. And that is her job. She does not do family medicine anymore. With any of these jobs, there's often the opportunity to do coverage. Everywhere there's high schools and small colleges and big colleges, and they need people to take care of the active athletes. Heather, for example, will likely take over a high school football team next season, and she might also help out with some high school hockey. And there is usually the opportunity for something, even if it's at the high school level. My job is actually a little bit different than all of those. So I work in student health, and I take care of the general student population while also taking care of the athletes. And so I really do use my primary specialty, which I didn't know that I was really going to use it so much when I went into sports medicine fellowship. And then I also have a bunch of teams that I'm the team doctor for. And so I see those athletes within my clinic while also seeing students from the general student population for both sports medicine complaints and other complaints. And so I kind of do a little bit of everything, but within a smaller scope of just college students. And so that's undergrad and graduate. So we have some patients who are a little bit older as well. The way that we do it at our school is not the way they do it everywhere. At some schools, they get their team docs from a sports medicine department. And so they don't necessarily work in their student health center or on campus, but they work off campus seeing their patients and then are also the team doctors for the teams. Other schools use doctors from different hospital systems. There's really no universal way to do it. Everybody kind of figures out their own way that works best for their school. A lot of people ask, like even my own family, why don't you go be a doctor for a professional team? You could make so much money, blah, 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 blah. That's not how it works. A vast majority of time, the hospital system actually pays the team to take care of the team because it's good for exposure. They get to put up their signs in the arena. And yeah, so it's not like you get paid the big bucks to be the personal doctor for some team. Usually that doctor will work in their own clinic, seeing their own patients. And then after that, they will go to the games and go to training room and take care of the athletes. So for the people who said you want to do exactly what I do and asking if it's possible to do it, yes, of course it's possible. There's not a ton of jobs exactly the same as mine, but they do open up. And if you're willing to wait for it, then yeah, you can do what I do. Maybe you can take my job when I retire. I hope this was helpful. I hope I answered some of your questions. If If you have any more though, please feel free to leave them down in the comments below and I'll try to answer them. All right guys, I hope you enjoyed the video. If you did, please don't forget to give it a like, subscribe if you haven't, and I'll see you next time.